My name is Carlos Cubas. I am the Director of Outreach and Training for the Bureau of Hepatitis, HIV, and STI, and I work in the STI program. My wonderful co-facilitator is here with me, Deanna Berlin, and she works for the Bureau of Public Health Clinics.
I'm Deanna. My pronouns are she, her, and I am a community liaison for the Sexual Health Clinics of New York City.
Welcome. This is STI 101, Introduction to Sexually Transmitted Infection. And as I mentioned, I work for the Bureau of Hepatitis, HIV, and STI, and Deanna works for the Bureau of Public Health Clinics. And just a quick recap of what that means is that Deanna works in a part of the Department of Health that works directly with the immunization clinics, the sexual health clinics, the tuberculosis clinics. And I work with more on the administrative side that works with the programs for hepatitis, HIV, and STIs. So that's like a quick recap of what that means. So what is an STI? STIs are infections that are passed from person to person through sexual activity, including vaginal, anal, oral sex. And they are sometimes called sexually transmitted diseases. And the difference between a sexually transmitted disease and a sexually transmitted infection is that it went from disease to infection because infections explain better on what a sexually transmitted disease would be, since there may not be symptoms. So somebody can have a sexually transmitted infection and not have a symptom, or know that they have an STI, which is what we refer to them as infections. Whereas the word disease had more of like a negative connotation of something that is urgent and presentable and visual. Like people would think that if you have an STD, then it's something that you can see, and it's like it had a very negative connotation. So infection is more descriptive of what it actually is. So we refer to them as sexually transmitted infections. You can see that also on the CDC website and on many of the NYC.gov websites. So as I mentioned, you can feel healthy and not know that you have an STI, but the best way to know is to get tested. So there are a number of behaviors that predict getting an STI, which includes condomless sex, having other STIs or sores, type and frequency of sex, number of partners, alcohol and or drug use, and how many people with STIs in one sexual network. And when we refer to sexual network, we mean the people that you may be having sexual encounters with and the people that they may be having sexual encounters with. So you may be sexually active with one person, but that one person may be sexually active with two other people, and so on and so on. So we want to make sure that communication is key in all of this. And it can be a little tricky having a discussion with sexual partners. Sometimes you may not feel comfortable talking about these things, or you may not know exactly how to ask about sexual partners or sexually transmitted infections. So it's important to understand the difference on how that is. One other thing that I like to point out here is when we talk about condomless sex is that when people think about condoms, is they think about external condoms, which is a condom that goes in a penis. But there are other options now. There are condoms that are internal condoms that can be used for vaginal, that goes inside the vagina and or inside the rectum. So there are different options. There's also dental dam. And dental dam is a latex protector that you can put and stretch out if you're going to have oral sex, and you can put it on the vagina or on the rectum before you do that. So it protects you. It's an additional protective layer. So we're going to talk about sites of sexual exposure, and not all sites of sexual exposure carry the same likelihood of STI acquisition. And this means that exposure at the rectum and vagina has higher likelihood of STI acquisition due to the presence of mucosal membrane, larger surface area, possibility of micro tears and trauma, and cervical tissue is vulnerable to STI acquisition. So what we mean in simpler terms of that is that the vagina and the rectum, the skin that's inside is referred to as mucosal membrane, or pink parts you may have heard from other presentations. And this skin is more absorbent because of the inside. You have mucosal membrane also inside your nostrils and inside over here and in your throat. So these areas are more sensitive. So to friction, it may cause micro tears. And what we mean by micro tears or trauma is that there may be a cut, but you may not see it, you may not feel it because it's so small. So that's what we also refer to as possibility of micro tears and trauma. And because rectal tissue is even thinner than vaginal tissue, exposure to an STI in the rectum carries highest likelihood of STI transmission. And what this means is that because the area of the vagina and the rectum has mucosal, any bodily fluids that are inserted can remain there for a while. So it increases the likelihood of STI acquisition as well. So exposure at the urethra and the mouth or throat do have lower likelihood of STI transmission, but these exposures do still lead to STIs. So very important. Somebody can have oral sex and they may be exposed to gonorrhea or chlamydia. There's also oral herpes, I believe HPV, and I'm trying to think of other ones, but we're going to cover that in the next couple of slides. But there is the likelihood of that as well.
So I would love to talk to you about the big three, which in New York City, we call the big three. We call that chlamydia, gonorrhea, and syphilis. These three are bacterial infections, and they all have cures and treatments, and they are pretty common, especially around New York City, and we'll talk about that a little bit more too. So first of all, chlamydia. It's a bacterial infection. It's spread through oral, anal, or vaginal sex, and it's the most commonly reported bacterial STI. And so just like we showed earlier, condoms and the dental dams offer the best protection to prevent chlamydia. And just the same with gonorrhea, it's also a bacterial infection. It's spread through oral, anal, or vaginal sex. And condoms and dental dams also provide the best protection to prevent against gonorrhea as well. So when we're looking at STIs, and just like Carlos said earlier, there are many times where there are no symptoms for STIs, but occasionally, and sometimes, there are symptoms present. And some of those could be like discharge from the vagina that's different than normal, bleeding between periods, yellow or green discharge or drip from the penis, pain or bleeding during or after sex, pain during urination, constipation, rectal pain, bleeding, or discharge. But it's very common for someone to have no symptoms and, continue their sexual practices and not know their chlamydia or gonorrhea positive and, go on with their life. So it's really good to get tested. And that's probably one of the main things we'll say over and over again for STI testing. So yeah, maybe someone wants to get tested and they want to learn more about testing and treatment. So depending on the types of sex that you have, those are the sites that providers can test for chlamydia or gonorrhea. For example, a urine sample, they might swab the cervix or the urethra or the vagina or the throat or the rectum. And so it's very important to be honest with providers if you're feeling safe in those environments to make sure they can get the proper testing for you. As far as treatment goes, chlamydia is treated with antibiotic pills and gonorrhea is treated with an antibiotic injection. And some partners or some participating providers rather can provide expedited partner therapy or EPT. It's this excellent thing that if you test positive, it's for example, at our sexual health clinics, you can get a prescription, if you test positive for chlamydia or trichomoniasis or, other things, you can receive treatment for your partners. And doesn't matter how many partners that you have, but you are able to receive that treatment without them going to the clinic. And this is a type of harm reduction for STIs, because we want people to come into the clinic. We want people to get their full panel and full examination, but this is one thing that can happen and can be used for trying to treat partners that are unable to come to the clinic. Pelvic inflammatory disease, or PID, it's one of the outcomes if chlamydia or gonorrhea is left untreated. And so they call it PID, and what happens is bacteria starts in the lower reproductive part of someone biologically female or assigned female at birth, right? So there's that part down there, the lower part of the reproductive genital tract, and then it moves upwards if it's untreated, the gonorrhea or the chlamydia or other things, right? And then it hits the reproductive organs like the fallopian tubes, the ovaries, the uterus, and it can cause a lot of different issues there, like scar tissue inside and outside of the fallopian tubes, ectopic pregnancy, infertility, and long-term abdominal pain. And obviously we want to prevent these if possible, because these can be long-term and oftentimes fatal, ectopic pregnancy can be fatal outcomes. So we want to prevent this if we can. So this is treatable, and we can treat the STI as well. Just for reference, you can look at our picture here. You can see on the left-hand side, it's a reproductive system without pelvic inflammatory disease. And on the right, there's one with pelvic inflammatory disease. And you can see there's pus, there's inflammation. You can see ulcer or, blockages from the discharge in the vaginal canal. You can see, the abscesses, this larger thing on the fallopian tube. So this makes things painful and can have a lot of different symptoms for someone who has untreated STIs. We want to prevent this if we can.
I'd also like to point out that with pelvic inflammatory disease, with PID, which happens if you don't get chlamydia or gonorrhea treated, it'll hurt. So there will be abdominal pain, and people may not know why they have abdominal pains, and they may just try to ignore that and continue with their lives, and it has happened. So if this is something that you may want to address your primary care physician or the emergency health cares if you use them, or CDMDs or our sexual health clinics, and make sure to mention, oh, I do have abdominal pain. So if you have ever been to the doctor and they start pushing on your abdomen area, they're checking for a couple of things, but this is one of them also. So in the same area of bacterial infections, syphilis is a bacterial infection and is characterized by stages including primary, secondary, and latent. And we refer to primary and secondary within the first 12 months of somebody being exposed to syphilis. Primary would be from the day of exposure up to 6 months, and from 6 months to 12 months, it's secondary. And then anytime after that, we refer to as latent or late latent syphilis. And that is important to understand because it changes the kind of medication that one receives, which we'll talk in a second. So it is spread through oral, anal, or vaginal sex, and it can spread to a baby during pregnancy. Condoms and dental dams offer the best protection. And in the images here, we can see where syphilis entered the body through the tongue in the image on the left side. And on the right picture, we can see a rash on the palms of the hands, which is something that can happen during secondary stage of syphilis. And the chancre is the primary stage of syphilis. Now, these don't necessarily happen in that order. You may get the chancre and the rash, or you may not get a rash at all, but it's important to make sure to speak to your provider and let them know if you have had this in the past. It can also happen on the soles of your feet or in your back or in your body. And the chancre can happen on the penis, the vagina, the rectum, or any body part that you used to have sex that may have been exposed. So very important to mention this. And it won't hurt. You're not going to feel like it hurts, and it'll go away on its own after 2+ weeks. So make sure to point this out to a provider if it has happened to you. Because syphilis can stay in the system for decades, and after 10+ years, it can cause additional symptoms that can include blindness. It can affect your nervous system. It can affect your eyes. It can affect a lot of different parts of the body. So we want to make sure that the people are aware of the information so they can talk to the provider and get tested. So healthcare providers can test for syphilis using a blood sample. Syphilis can be treated with an antibiotic injection. And as I mentioned, depending on the stage of where syphilis is, people with primary or secondary syphilis are treated with a single shot of penicillin. And people with latent syphilis or late latent syphilis or unknown time, which is more than a year or more, syphilis is treated with 3 shots, each 1 week apart. And this is usually a very heavy injection that goes on the butt. It has to be in the meaty area, and the antibiotic is drained into the body over a course of time. But the 3 shots are something that if you have had syphilis or didn't know that you had syphilis for like X amount of time, that you will receive 3 shots each 1 week apart. And congenital syphilis, it occurs when a pregnant person with syphilis passes the infection to their baby during pregnancy. Congenital syphilis can cause miscarriage, stillbirth, prematurity, low birth weight, or death shortly after birth. So again, important to be tested. I believe in New York City, there is mandatory to get tested during the 3rd trimester, but there are people that may not go to a pediatrician or to a doctor that may have a live birth. So it's important to get tested otherwise.
So I'll talk to you a little bit about HPV, herpes, and trichomoniasis. So maybe you've heard of HPV before, human papillomavirus. It is the most common STI in the US, and it's spread through vaginal, anal, or oral sex, and also genital to genital contact, even with no symptoms. So it can cause genital or anal warts and cancer in some cases. And it's really important to note that with HPV, which is a type of virus, there are hundreds of strains or over 100 strains, right, of HPV. And some of them cause cancer, some of them cause warts, some of them, your body might just have and, might not cause any symptoms at all. But some of the cancers that may be related or might be caused by HPV are anal cancer, oral pharyngeal cancer or throat cancer, vulvar cancer or of the vulva, vaginal or penile cancer. There is no cure for HPV, but there is a vaccine, which is amazing, called the Gardasil vaccine. It's usually recommended for people before they start having sex, like in their preteens, like earliest, like 9 years old, sometimes to 12 years old. But if you have not had the Gardasil vaccine, it might not be too late, right? Because we may have been exposed to some HPV strains, but maybe we haven't been exposed yet to the strains that cause cancer or warts, So it's best to talk with your medical provider to see if maybe the HPV vaccine is for you if you haven't received it when you were preteen or you haven't received it yet. So also another viral STI that we talk about a lot is herpes. It's a virus that spreads during skin-to-skin contact. So these are some of the things we know. We talk about like oral, anal, vaginal sex, where it's like those types of like sexual contact, but it's also like sometimes just the skin-to-skin like we're talking about here. Oral herpes can be spread through kissing, right? And then oral herpes can also be spread to the genitals during oral sex. And herpes can spread without someone having visible sores. It's called asymptomatic shedding. So there doesn't have to be like an outbreak on someone's mouth or genitals for it to be spread. There's no cure for herpes, but there are medications that help reduce the outbreak frequency, shorten the outbreaks, relieve discomfort, and just decrease the likelihood of transmission or spreading herpes. And oftentimes with herpes, the biggest problem, there's not really any negative health outcomes for herpes. It's more so the stigma and the social stigma that comes with herpes that is the biggest factor here, because the only time that herpes is deadly or can cause a large negative health outcome is during pregnancy, if it's spread through to the baby during childbirth, and it can be very dangerous in that point, but otherwise herpes isn't dangerous. It's mostly just the stigma that causes a lot of discomfort, and besides the rash itself. So I also want to talk to you a little bit about trichomoniasis. So we talked about bacterial infections. So we talked about these different types of infections. We did bacterial, we talked a little bit about viral infections, and we'll continue to do that too. But I want to talk to you about a parasitic infection, and it spreads through vaginal sex. And sometimes trichomoniasis is called trich, as our third bullet has here. And things like trichomoniasis or even chlamydia, gonorrhea, any STI really, it can make it more likely to transmit or acquire HIV, which is super interesting. And also the way HIV emits and the way the transmission works is that it attaches to or enters the body through white blood cells. And if you have an infection anywhere in your body, white blood cells are the things of your immune system that try to fight off an infection. So if you have an infection of the reproductive system, HIV might be able to enter the body easier because there's more white blood cells trying to fight off the infection that's going on in the reproductive tract. So trichomoniasis or trich is tested by swabbing the vagina to test a sample of fluid. And also you can test the penis by swabbing the urethra. And you can treat trichomoniasis with antibiotic pills. And yeah, so it's usually only spread through penis to vagina or vagina to vagina sexual contact. It's not normally spread anally.
So bacterial vaginosis is not technically an STI because it is not spread between partners. It occurs when normal bacterial balance is disrupted in the vagina. And what this means is that there is a pH balance in the vagina or bacterial balance in the vagina that can be disrupted. So there is good bacteria that lives on our bodies and in the vagina, and this can be disrupted with partners or using different toys or having sexual intercourse or using fingers or having oral sex with the vagina, and that can upset the balance of what's going on in the vagina. So that's what we refer to as bacterial vaginosis. And it's not technically an STI because it can happen if you're not having sexual intercourse. You could be using toy or something else can disrupt it. It can be caused by having near multiple sex partners. And again, it's not transmitted through the partner. It's just the bacteria that enters the vagina that can offset what's already going on in there. And well, I shouldn't say what's already going on in there. It makes it sound like a machine. it can upset the bacterial balance inside the vagina. Let's just put it more technical. Because BV is not sexually transmitted, it cannot be prevented with condoms. So even if you are having intercourse with partners and they're wearing a condom or you're wearing an internal condom, you might still upset the bacterial balance in the vagina. Now, very importantly, and Diana points this out often during presentations, there are flavored condoms that people use for oral sex. And it's very important to not use flavored condoms for intercourse with the vagina, because the flavored condoms may contain sugars or something else that can upset the balance in the vagina as well. So very important note. So bacterial vaginosis is treated with antibiotic pills or creams that are applied to the vagina. We'll move on to hepatitis A. And it is a short-term infection caused by a virus that can enter the body through the mouth and is passed in stool. It can infect and can damage the liver, and it can be transmitted during sexual activities such as fingering, oral anal sex, or rimming. And rimming is when you're having oral sex with the rectum, putting your mouth to the rectum, fisting, using anal toys. And there is no treatment for hepatitis A once symptoms appear, but most people fully recover on their own by resting and not drinking alcohol. And for hepatitis A, B, and C, some of the symptoms may be jaundice, which is when the skin turns a little bit yellow or the white in the eyes turn yellow. You might have fatigue, you might have diarrhea. And these are all, again, if you're having any kind of symptoms, please make sure to let your provider know. So with hepatitis B, very similar to hepatitis A, this is caused by a virus that infects and can damage the liver, and it's passed from one person to another through blood, semen, or vaginal fluids. So there's a difference there between hepatitis A, which is passed through stool, feces, or poop, and hepatitis B is passed through blood, semen, or vaginal fluids, and it can be transmitted during birth by having condoms sex, by sharing needles, injection equipment, or unregular tattoos or piercings. And antiviral pills can slow the progression of liver disease among people living with chronic hepatitis B. And when we say chronic hepatitis B is that is somebody that has the virus for hepatitis B for life. So that's something very important to know. So if you do get hepatitis B, there are medications to treat it, but there are medications to treat people that are living with chronic hepatitis B. So very important to understand the difference with them. So with hepatitis C, again, it is caused by a virus that infects and can damage the liver. This is passed from one person to another through blood, and it can be transmitted by sharing needles, injection equipment, during birth, unregular tattoos and piercings, and condomless sex where there is the presence of blood. Hepatitis C can be treated. Diana mentioned earlier that this is one of the only viral infections that we'll be discussing that does have a cure, and it does have a cure and it can be treated. The antiviral treatment lasts 8 to 12 weeks, and it involves taking 1 to 3 pills a day. And the treatment has very few side effects, and cure rates are very high at 97 to 98%. And again, this is great because less than 10 years ago, the treatment for hepatitis C was a cocktail of medications that were somewhat harmful to the body. So now I always say this during the training, and I always forget to look it up, but I know that this happened in the last 5 to 7 years where they came up with this new treatment that's 1 to 3 pills a day for only 8 to 12 weeks. Whereas in the past, it was pills, a handful of pills, I think for like 6 to 8 months or longer than that. So this is a great progression of treatment for hepatitis C.
So we talked about a lot of STIs today, and I think after every STI 101 or every time we go out and talk to community members about STIs, the next question is like, oh, where can I get tested, or what can I do? Like, what's next? So I would love to give you a resource just in case, or for you or for family or friends. That is a really great resource around 4 out of the 5 boroughs. So I'll show you a map here. We have 4 open locations right now. We have a location in Chelsea. We have one in the Bronx in Morrisania, Fort Greene in Brooklyn, and Jamaica in Queens. And hopefully we'll be opening the Corona Clinic very soon for PrEP and other wonderful things. We also have we have vans right now in Corona and in Central Harlem that do like rapid testing, and they're wonderful. We have wonderful community partners, organization partners that provide services there too. So you can come to the clinic on a walk-in basis. You don't need an appointment, or you can call our telemedicine number, which I'm going to provide to you in case you need it. And services, you don't need to be able to pay for them. You don't need insurance. You don't need immigration status. So none of those things. And it's confidential. You don't need documentation. And the only thing you might need is if you don't have access to like our portal, or you want to get your results in person, you might need your ID on a second appointment, but you don't even need an ID to come and get services here. And this is open to anyone ages 12 and up. So there's no parental notification needed. They can make it so that insurance doesn't say that it's from the sexual health clinics, or we can process it without insurance as well. So yeah, what can you get done at the sexual health clinics of New York City? You can get evaluation for STIs, HIV, you can get testing, treatment, screening. We're also doing monkeypox or MPX or MPVX, with one of the many acronyms that we're calling monkeypox now. I'll refer to it as MPV for our time together today. We're doing the treatment, testing, evaluation for MPV at our clinics too, which is great. But yeah, so anyone ages 12 and up can get these services. We also have contraception, emergency contraception, like the Plan B pill. You can get an IUD here or any other sort of birth control method. And the telemedicine hotline is also an option. If you can't come to the clinic, you want to ask a professional question or see if we have capacity for the day, you can call our telemedicine hotline, which is here. But yeah, so you can get PrEP, PEP, all those great things. Also, if you're a patient with us, you can get, I think it's 12 mental health sessions with our social workers. But we do PrEP initiation. We can follow you with PrEP, and we are doing MPV testing treatment at the sexual health clinics too. Lots of different resources, but I definitely recommend the website and our telemedicine hotline, because I would hate if someone comes all the way out here, because a lot of things are walk-in basis. And, we are usually open until about 3:30 each day. But if we hit our capacity or hit our total number of people by, the beginning of the day, then you might not get seen. So I always advise looking at the website and even calling our telemedicine hotline to be like, oh, hey, like, can I come? Like, is it at capacity? And they can give you a better idea.
You or someone qualifies for the MPV vaccine, we're doing the direct appointments at Central Harlem. So you can always contact us and we will help you get an appointment directly. We have access to like a block of appointments that are not public. So we have sort of an extra little in there. So make use of us.